Today I am going to talk about one of my recently conducted studies with the title of Empowering Early Detection by Unveiling the Factors Behind Delayed Breast Cancer Presentation at the Tertiary Cancer Hospital of Bangladesh. So as we all know, breast cancer is the leading health concern for women throughout the world, with over 2.3 million cases occurring annually, making it the most common cancer among adults. And in more than 95% of the countries, breast cancer is the first or second leading cause of female cancer death. But interestingly, the breast cancer survival rates vary greatly throughout the world. If you have a look on the world, in some parts of the world, the survival is as high as 80%, whereas in some other parts of the world, the survival is as low as 40%. So the question is why? Why the survival from breast cancer varies widely, inequitably between and within nations? So if you have look on this, that is from the American Cancer Society Cancer Facts and Figures 2023. They have said that breast cancer, when caught early and treated accordingly, the overall survival remains as high as 99%, while the late stage diagnosis drops it to only 27%. So from here we have a clear assumption that delayed diagnosis and later stage at presentation is strongly associated with lower survival. And therefore, in a developing country like ours, to improve survival, we should focus on early detection. And how? By addressing the obstacles responsible for delayed presentation. And with the aim of that, we conducted our study where our objective was to find out how often our patients present in delay, and to pinpoint the underlying reasons behind their delay, and also try to find out whether there is any potential link between delayed presentation and different socio-demographical variables at our settings. So how we did this? We interviewed all the newly diagnosed breast cancer patients who attended the OPD of Asani Mission Cancer and General Hospital from January to June 2023. And each patient was questioned about whether there was any presentation delay or not, and how we defined our delay. So a delay in presentation is defined as a duration of 90 days or more from the onset of symptom to seeking medical attention, obviously by expert physician, not by any cancer quack. So upon receiving informed consent, patients were asked to complete a questionnaire regarding their delayed presentation. And data was also stratified with respect to studied socio-demographic variables like age, marital status, socio-economical status, educational status. And after collecting all data, we analyzed them systematically. Moving toward the result, let's see what we found. So we found a total of 157 newly diagnosed breast cancer patients attended the OPD of AMCGH during our study period. And among them, 55 patients had delayed presentation according to our definition of delay. So if we calculate that in percentage, we can see 35% of our patients had delayed presentation during our study period at our center. Now we'll talk about relation between different socio-demographic variables with patients' presentation status, starting with age. So is there any correlation between age and delayed medical presentation? Well, to find out that, we divided our patients, different age groups, starting from very young patients, that is less than 30 years, to very elderly patients, that is age more than 70 years, with the interval of 10 years. And let's see what we found. So here in this bar diagram, here the purple column represents the patients, Here the purple column represents the patients who had delayed presentation and the pink column who had earlier presentation, that is presentation less than 90 days. So if we have a close look on the elderly age group, that is age more than 50 years, you can definitely see that patients who are elderly, they had more tendency to present in delay. Moving toward the marital status. So is there any relationship between marital status and tendency to delay seeking medical attention? Well, to find out this, we divided our patients into 3 groups. The first group comprises the women who were single, the second group who were married, and the third group who were either widowed or divorced. So let's see what we found. We found very interesting findings that the patients who were either divorced or widowed, they have more tendency to present in delay. Moving next, does educational status has any impact on patients' medical presentation? Well, to find out that, we divided our patients into 3 groups, that is illiterate, then the patients who studied up to primary, and then the third group comprises the women who studied beyond primary, that is either having secondary study or had higher education. And we found in our study that the patients who studied beyond primary, that is up to secondary or higher education, this group of patients comprises only 9% of the delayed presentation group. Remaining all were either illiterate or studied up to primary. So, moving next, is there any potential link between socioeconomic status and patient's presentation? Here we divided our patients into 2 groups. The first group comprises the women who were from poor or low socioeconomic status, and the second group comprises the women who are from middle or high socioeconomic status. And we found in the delayed group, 60%, that is majority of the patients were from poor or low socioeconomic status, where in the early group, 66% patients were from middle or high socioeconomic status. So from here, we got our targeted group, that is the patients who were elderly, who are either widowed or divorced, not that much solvent, not that much educated. These are our targeted group that we should have a special focus on. Now, we are going to talk about the causative factors for delayed presentation of our patients. We got several answers from our patients, and finally we were able to divide them into 5 different reasons. So let's see what we found. Use of alternative medicine. We found many of our patients having delayed presentation after noticing their lump initially, as they wasted their time by using that so-called cancer medicine or alternative medicines, that is homeopathy or Kabiraji. Moving forward, we found many of our patients who had delayed presentation due to financial burden, because they don't have enough resources to cover the expenses of breast cancer management. After noticing their lump, they become busy for arranging money, and which is quite time consuming, and by the time the situation gets worsened. Painless breast lump. Several patients presented late due to painless breast lump that they either failed to notice or didn't think it was serious enough to warrant a visit to the doctor. We found a very interesting reason, that is feeling shy about expressing breast concern. A significant amount of our patients were experiencing feeling of shyness when it came to discussing their breast-related concerns with their family or friends. Furthermore, many of them were unaware of where to turn to for help and guidance on this matter. And finally, we found several other reasons, like living in remote areas, fear for surgical procedures or organ loss. I must say, we found several patients who were only the victim of their culprit husband, because after noticing their lump, they informed their husband that they are feeling something abnormal, but the husband was so ignorant, and by the time the situation worsened, and this husband abandoned them, and finally they came to us with their paternal relatives, like brother or father. And we also found some patients who had delayed presentation due to pregnancy or lactation, as because they couldn't manage to differentiate between the change due to pregnancy or lactation in the breast or due to the cancerous breast lump. So can you tell me which reason has the most significant impact on delayed presentation? Anyone? Is it painless lump or financial crisis or alternative medicine? Oh, very interestingly, we got this, that 30% of our patients had delayed presentation only due to they don't know the fact that painless lump is the most alarming sign of breast cancer. Then 25% of our patients had delay due to alternative medicine, that they don't have the idea what is the proper treatment of breast cancer. 21% of our patients had extreme shyness. We found this mostly in the patients who are either widowed or divorced. Then we found 14% of our patients had delay due to the financial crisis, and 7.27% patients had delay for other reasons. So from our study, we can conclude that a major percentage of the breast cancer patients are diagnosed late with advanced stages of disease because they are unaware of the sign and symptom of the breast cancer and its proper management. So we should work on educating our women, especially the focus group that we have found from our study about breast cancer sign symptom, how to do breast self-examination, and where to seek medical attention, and most importantly, where not to go. We also need to break the social taboo surrounding breast-related concern, where it is often considered as a matter of shame. To achieve this, we can implement coordinated initiatives like community outreach programs, targeted advertising campaign, providing resources in various local languages, and using print media, electronics media, social media to reach the people from diverse backgrounds. And we need to implement widespread breast cancer awareness and screening programs at root level and encourage our women to enroll them in that program. And if we can do so, we'll be able to reduce delayed breast cancer presentation to a significant level, which will ultimately lead to improved outcomes of our breast cancer patients. So thank you for your kind hearing. Thanks a lot.